Wala ka na pag-cellphone. Pasyente. Ayan. Gagi ka, ba't ito pinatong doon? Basa doon. Hindi, okay lang yan. Yeah. Ay. Hindi naman kita yan eh. Ayan. So, good day. My name is Lucas. Lucas today. My name is Luke ARLETA and I'm your student nurse with the Line Educational Foundation Incorporated. And today I will be demonstrating to you the assessment of the pulse rate and respiratory rate. But first, we will be conducting the pulse rate since this will be connected with taking the respiratory rate. Kita ba ako? Ayan. So, before we begin, the pulse measurement is a measurement of the pressure created by the heart when it contracts and it ejects blood from the aorta, creating a pulse within arteries. So the purpose of this is to provide clinical data and to determine the adequacy of the peripheral artery blood flow. Okay, so the equipment we will be using today is equipment. We need alcohol swabs right here. We need a watch. Siyempre yung watch. And we need gloves. Pero itong gloves, ito po ay optional if necessary. Yan. So, we will begin the assessment of the pulse. So I have prepared all the necessary materials for the to avoid loss of time. And position your patient in a supine position like this one. And now we will begin with introduction of myself and explanation of the procedure to the patient to reduce anxiety and facilitate cooperation within the procedure. And syempre, we will conduct hand hygiene. Wait lang, kunin ko yung alcohol. Hand hygiene to reduce the transmission of microorganisms. Yan. Woo! To avoid cross-contamination. And yun nga, have the patient in supine position and be sure to provide privacy, to ensure privacy for the patient. And so we are private right now. And yun nga, naka-supine position na. And have the patient's arms like this extended. Have the wrist of the patient extended and with the palms facing downwards. This is because the position like this will enable me to detect the pulse of the radial pulse properly. Okay, so with my index finger, middle finger, ring finger, I will palpate the radial pulse gently or with enough pressure so that the pulse so that I may feel the pulse. Buhay ka pa ba? And rest your thumb on top of the wrist. This is to facilitate proper taking of the pulse rate. Pulse. So now I have found the pulse and I will begin counting the number of times it beats in 1 full minute. This is because yung mga irregular beats po, kailangan po siya ma-assess in 1 full minute. So that yun nga, ma-determine po natin kung ilan po yung the number of yung irregular meetings. Yun. Ayan. So, I will begin now. Okay, so now I have determined that the pulse rate of the patient is 76 beats per minute. Okay, now I will begin the assessment of the respiratory rate. So, yun nga, habang nakasupine position pa rin yung patient, still hold the wrist of the patient and while observing his chest cavity, his chest wall and abdomen moving up and down. So, same procedure din. One full respiratory cycle is one inspiration and one expiration. So, yun po yung full cycle of respiration. So, pagkatapos ng isang expiration and inspiration, then saka lang po tayo magka-count. So, normal respiratory rate is 12 to 20 breaths per minute. Okay, now I am observing the respiratory, the movement of the abdomen. Okay, so the patient has a respiratory rate of 15 breaths per minute. Okay, so I will instruct the patient to come up now. Ayan, pasensya na. And, ayun. So now we are done with the assessment. Okay, so yung mga results po natin is we will chart them properly for for comparisons and evaluations later on. And ayun lang. So we will conduct proper hygiene for the last time to avoid the transmission of microorganisms. And we are done with the assessment of the TPR. Thank you so much for watching my vlog, my demo, and be sure to like and subscribe for more. Okay, I have been your student nurse, Luke Gerald Arleta, and I will see you next time. Bye-bye. Thank you.